Hi, namaste to all. And today I am coming with an interesting video. Question is, where does psychiatric examination fit in clinical medicine? And answer is, I propose psychiatric examination as a fifth systemic examination in medicine. I am Dr. N. Manjunatha, working as additional professor of psychiatry at NIMHANS, Bangalore, India. I have a disclaimer. It is a prequel video to my first video on psychiatric examination, which I appeal to replace the mental status examination. And I will use the term psychiatric examination in place of MS in this video. For those who have not seen this debate video, I have added a video link in comment section of this video for a quicker navigation. We read this: clinical medicine, methods in medicine, clinical evaluation in medicine, clinical assessment in medicine. There are 5 steps in clinical evaluation. First is clinical history, which all of us know, to elicit symptom, and clinical examination, which elicits the signs, and we know that it is head to toe complete examination. Then comes investigation to confirm the finding, and fourth, diagnosis and management plan. In this video, we will focus on clinical examination to identify the signs. There are 3 types of clinical examination in medicine, which all of us know. It is called general examination, systemic examination, and local or specific examination. Please note here that the term physical is been artificially added with ignorance of psychiatric dimension as general physical examination and systemic physical examination. Request to note in future use. Coming to general examination, though general examination has slight variation in different clinical sectors, especially routine and emergency kind of thing, more or less same. First look of the patient is very, very important in general examination, which is face, gait, sitting postures are very important. There are next comes to 4 primary vital signs: body temperature, blood pressure, pulse rate, respiratory rate, and I will be proposing 5th primary vital sign from the psychiatry in later video. Please wait and watch. Then comes what we generally call general physical examination, which we use to keep the mnemonic of pencil, which comes as pallor, edema, clubbing, cyanosis, icterus, and lymphadenopathy. Then coming to systemic examination, traditionally there are 4 systems in which we need to examine: cardiovascular system, respiratory system, central nervous system, and abdominal examinations. These covers major systems and major organs of the human body. It is essential to rule out any underlying systemic pathology that may affect the patient's health. And coming to specific and local examination, it is a self-explanatory. It's depend upon the local area where you want to examine, depend upon the history. Is that? Then coming to mental status examination. Was and thus, as said, MS is served as a psychiatrist version of physical examinations. And psychiatry deals with mind. Everybody has different explanation for the mind, from layman to scientist, and from common man to the biggest universities on the world. For psychiatry, and to make it very simple, mind is a software for brain or body, and mind is also a functional aspect of the brain and body. Then coming to original my question, where does psychiatric examination fit within the 3 types of clinical examination of the medicine? Definitely it is not in a general, and definitely it is not in a local or specific examination. It is, hence I propose psychiatric examination to be considered as a 5th systemic examination in medicine, after the traditional 4 systems of CVS, RS, CNS, and abdominal examination. And what is the rationale for this proposal? The presence of psychiatric symptoms and signs does not lead to diagnosis of psychiatric disorder. Please remember that. And psychiatric symptoms and signs can be manifestation of systemic illness of major systems, like as I said, CVS, RS, abdominal, CNS, blood, endocrine system, etc., or of any major organ like brain, liver, kidney of the body. Delirium is a very typical example to understand how we psychiatric disorders are diagnosed. And essential diagnostic criteria for psychiatric disorder is to rule out the systemic cause of psychiatric symptoms and signs. Primary psychiatric disorders are diagnosed only after systemic examination reveal no abnormality. To conclude, Psychiatric examination shall be included as a fifth systemic examination in clinical medicine, medical education, and all medical textbooks. This allows a comprehensive evaluation of the patients without differentiating psychiatric and physical health. All physicians must be trained in two things. One is psychiatric presentation of systemic illness and familiarity with the psychiatric examination to diagnose psychiatric disorder. Please like, share, subscribe for this kind of brainstorming videos. Also feel free to give your comment in the comment section. More importantly, I want all of you to think about this concept. If you are convinced, begin using it in a day-to-day clinical practice as well as your in clinical teaching. ಧನ್ಯವಾದ.